Hello everyone, my name is Dr. Parissis. Welcome to another video. In this video, I want to explore a very common question that myself and Dr. Bloxham get all the time is, will the hair transplant be painful? Now, the answer, we kind of want to split it up into two parts. So the first part is it painful during the actual procedure? And the second is afterwards, right?
Yeah.
Because it's not going to be painful before.
No,
right?
hopefully not.
Good. So during the procedure, the answer is that we give local anesthetic. So with hair transplants, they're officially minimally invasive. So they're not, you don't need to be under general anesthetic, you don't need to be put to sleep. We just give a small amount of what we call lidocaine, which numbs the area that we inject into. So to start, whether it's FUT or FUE, whatever harvesting technique we use, we are going to numb the back area. And it's just little pokes. So, a lot of the time patients will report it kind of feels like having a blood test, kind of a sharp scratch, several sharp scratches just around the back.
Vaccine or something like that.
Exactly. Then in the recipient area, same pokes, same local anesthetic. The good thing about the recipient area or the front area is that because the nerves that supply all of the scalp really come from up in the face, once we numb the frontal line here, we don't need to actually numb any more of the scalp. So as soon as you're numb here, you're numb everywhere. So that's what's really good about hair transplant local anesthetic is there's actually fewer injections needed there. But patients mid-procedure, they're walking around, at least on their breaks, watching TV, they're often on their phone, we chat to them, we often have a great time talking to our patients during procedures. So I'll ask you, Dr. Bloxham, that's during the procedure. What about after the procedure? How painful is it?
So it still should be minimally painful. I think that there's a little bit of a difference between the pain felt in the post-op with an FUT and an FUE. With an FUT, what I tell patients is the discomfort you're going to feel with both procedures actually is going to be in the back. With FUT, you can get sort of a distension, kind of throbbing discomfort over the stitch or the staple line. And the reason why is because throughout the day we're injecting fluid up here and your body's releasing its own inflammatory fluid up here, and that fluid needs to drain. And it needs to drain into some natural channels called the lymphatic channels in your neck. So it needs to go from here to here. And I put a big row of staples or stitches right across where the fluid is and where it needs to go. So as the fluid moves down over that stitch line or that staple line, that's when it causes that stretching and that distension, stretching pain. So regardless of how painful it is that first night, by the time that fluid works down, and it takes about 12 hours to do that, the pain should be gone. So I tell patients by the next morning you should be fine. We numb the patients before they leave, so you should leave the office feeling nothing. And we give you sort of a regimen of medication or recommendations of medication to use that night. Typically it'll be a narcotic pain medication, but I've had many patients that'll get away with just using Tylenol or I always forget,
Paracetamol.
Yeah, that's so close for
how we call it.
For you UK patients. I want to try to just avoid the pain and stay ahead of it. If you're numb when you leave the office and you sort of start some pain meds when you go back and you just kind of keep up on them, you'll go from feeling nothing because you're on pain meds to feeling nothing, or excuse me, because you're numb from the lidocaine, to feeling nothing because you're on pain meds. And then if you just keep up those pain meds and then go to sleep, by the time you wake up in the morning, that swelling, like I said, is pretty much down, and you should be in good shape. With FUE, you don't get as much of that sort of tightness, kind of like distension discomfort, because you don't have stitches or staples. But FUE patients report just kind of a generalized, like a stinging burning. It can kind of linger a bit more, I think, than the FUT discomfort, because for the FUT discomfort, once that swelling's down, you should be in good shape. That FUE kind of lingering, stinging kind of lasts a little bit, but typically Tylenol does a very good job. Very minimal pain, and it should be gone, pretty quickly after the procedure. And one last thing to note about the pain in the post-op is, ironically enough, patients rarely feel pain in the recipient. It's funny because if you look after the surgery, the recipient area can look so dramatic. It's red, it's a little shiny. You've got a terrible haircut in a lot of instances, and patients look at it and go, "Oh my God, this is going to feel terrible. My head's going to feel like it's on fire." It rarely is. It's a very interesting thing, actually, but I think it's because it's so, like you mentioned before, so minimally invasive. What we're doing up here is almost like making little paper cuts to put those grafts back in. So I almost never get a patient that reports discomfort in the recipients. It's almost universally the donor, and even then, it's very, very manageable, very reasonable. So.
there you have it. I hope that answers the question about whether a hair transplant is painful. Thank you guys for watching, and see you in the next one.